Moving ahead, our last and third panel for the day is about mental health in India. And the topic is addressing the invisible enemy and unlocking a holistic well-being, which delves into a pivotal issue, which is mental health, especially in our societal factors deeply influencing mental well-being. This discussion will aim to unravel the complexities around it. And at a personal level, I have been a patient of postpartum depression for 1.5 years, and there was no help coming from anywhere. Especially family members did not understand my problem, and they would just tell me कि ये तो सबके साथ होता है. So I would really pity them कि आपने कुछ किया क्यों नहीं उसका. Anyway, so there are so many challenges. Mental health especially is something that is not so much talked about but understood, first of all. So here with our esteemed panelists today, we'll try to explore ways to enhance access to mental health initiatives and services. So I will not like to waste much time, and I would like to introduce our esteemed panelists here, and in alphabetical order. We have Ms. Ashwini Thakkar, Commercial Head, Arogya World. A very warm welcome to you, Ashwini ji.
Thank you, Ruchika.
Then we have Ms. Bhavna Srirangam, Change Leader at Inguvu Collective.
Thank you. I'm very, very glad to be here.
Thank you so much. And then we have Ms. Diksha Sekhri, Foundation Lead, Royal Rajasthan Foundation.
Much for having me.
Then we have Ms. Megha Sharma, who's the founder and CEO of Panacea HealMed. Very warm welcome to you.
Thank you for having me here today, Ruchika.
And then Ms. Sakshi Sharma, she's a clinical psychologist from Mind Root Foundation. Very warm welcome to you.
Thank you so much for having me today here.
Our pleasure. Ms. Samia Naseem, co-founder, LoanPack.
Hi, thank you so much for having me.
And then, of course, Ms. Vidya Bhojan, founder, Right Thoughts, and we've always been in touch with her, and it's always been very, very enlightening just speaking with her. So a very warm welcome to all of you, and Vidya ji, thank you so much for joining us.
All of you. Thank you for having me here, Ruchika.
Yeah. So as we were talking about the societal challenges that people face, especially in our country, and there is, a block in the sense that people do not want to understand mental health problems that we have, and it is very normal, outside. If you see outside of India, there are many initiatives and interventions at every level, at the health level, education level, which actually tries to build that kind of awareness and sensitize people about the issues. Just talk about briefly about the kind of work that you're doing in this domain. So again, I'd like to begin alphabetically. Ms. Ashwini Thakkar, can we have your views on this, and what exactly are you doing?
Sure. Thank you once again. Thank you. I'm really happy to be a part of this esteemed panel of guests who are here. So a little about Arogya World. Arogya World is a global health not-for-profit.
I'm sorry, Ashwini ji, I need to interrupt. I'm really sorry. I forgot to introduce.
Objective is to reduce the non-communicable disease burden in India through education, awareness, and behavior change. And we follow a doorstep model. So we reach out to communities, we reach out to schools, and we reach out to workplaces. So typically we look at both physical and mental well-being because the two cannot be separated. And we've been in this space from 2010, and we are growing. We are actually a very small team. Our CEO, Dr. Nalini Saligram, she is based in the US. We have our core team based in Bangalore, and we just have a few people in Mumbai and Delhi, and I'm based in Mumbai. So I've been with Arogya for the last 3 years, but primarily my work has been in the corporate world. So it's a huge change for me from the corporate sector to the social sector.
Oh, amazing. So can we move to Ms. Bhavna? Bhavna ji, can you tell us what exactly is your role, and what is the work that Inguvu Collective is doing?
Sure. Thank you. Once again, very, very glad to be a part of impactful conversations like this, and definitely very thankful to the CSR Universe for initiating dialogues on such sensitive topics that, so far have been overlooked. Hello, everyone. My name is Bhavna. I'm a change leader from Unguvu Collective. So Unguvu Collective she creates change, a flagship program for women change leaders, where they nurture women change leaders to identify important issues in our society and work towards tackling them. So I have also finished a very extensive digital campaigning training program with them. And then I started my campaign at the intersection of mental health and offering support for women who are survivors of domestic violence. So right now my online campaign and initiatives are surrounding building stronger mental health support systems at the government level for women who are survivors, who have had the courage to come forward and seek help and breaking the chains of for domestic violence. So I'm aiming at bringing these kind of changes and equipping everybody at places like Sakhi centers who offer help for women by training them in these very, very informed and equipped areas.
Wow, that's some commendable work you're doing. Amazing intervention there. So, Ms. Diksha Sekri, can we have a word from you?
So, hi, I'm Diksha, and I run the foundation for Rajasthan Royals, the IPL team. So, with us, I mean, our chairperson has always been a big advocate of mental health to the extent that back in 2019, we had Shane Warne come in to India and we did a partnership with McLean University, which is a Harvard Medical School affiliate, a mental health hospital. And we actually did a whole offline exhibition on mental health. And we actually had Shane Warne hold a real human brain in his hand to actually bring out that, this is mental health is as important as physical health. And this is back before COVID. We knew we wanted to do something in this space for a long time. And we did smaller interventions during COVID. We did podcasts with, cricketers like Rahul Dravid, Varun Aaron, Robin Uthappa, who openly spoke about mental health challenges. I mean, those podcasts and the videos are still there on our website. They were a huge source of inspiration. But as we move forward and we realize that, we do so many projects in access to water, to solar, to livelihoods. But what we were lacking was, every time we kept thinking we'll do a separate project for mental health, which we did as well during COVID, the awareness and stuff. But now where we have come to in our evolution of understanding mental health is that we want mental health to be part of each and every program we do. So even if we are doing an intervention with women on better sustainable agriculture practices, we are giving them mental health access. We are giving them awareness workshops. We are and to take this forward, we last month launched a campaign with Sony Pictures, which was a national level campaign with Miss Sonali Kulkarni as our brand ambassador for it, which ran on, all the channels of Sony, talking about the various phases of a woman's life and how women are actually, they face like almost double the mental health issues that, men do in our country and globally as well. So that was more of a mass awareness thing that we have done with Sony Pictures to take it across India. Along with that, we tied up with the Sangat, and we were going to tie up with Vaisa as well. We were already done a meeting with Ria for that.
Great.
Yeah. So we wanted to also have a call to action, and the women through the campaign we've had a call to action for the mental health helpline. We're also doing mental health workshops on the ground, as well as tying up with, another platform called Koto, wherein we are creating online conversations for the same. So that's the kind of approach that we are going forward with for our mental health intervention.
That's incredible. I wish you were there during my time. So, Ria, moving on to you, over to you. Please, could you share and elaborate the objective and the kind of work your organization is doing?
Absolutely. Hi, everyone. Very pleased to be amongst all of you doing very inspiring work. Briefly put, Vaisa is an AI-powered conversational chatbot where anybody can, access the chatbot, download it from the Play Store, App Store, and free of cost, just right on their smartphone. receive mental health support that is as effective, as clinically backed as human therapist support. And so that's essentially the mission of WISA as a offering, is to be able to deliver mental health care at scale, given that it's a digital intervention, overcome barriers of access, affordability, and really reach millions more people to give them the care that they need, just given the demand is acutely unmet, as everybody on this panel would very well know. I'll look after strategy and impact at WISA. And it's a unique role because I sit at the intersection of business and social impact. It's an interesting time to be a mental health tech startup, because we're now at a stage where we're the first, I think, in the world to develop our entire AI chatbot in Hindi. And that's, of course, the first step. Our goal is, of course, to be present in many more regional languages. And the essence essentially is to the next frontier, right? Like, you've served, the top of the pyramid, English-speaking users, people who actually are asking for help, but there's a huge layer of people where there's not even shared vocabulary around, do I need help, or am I even going through something that requires attention? And so I think to get to those users, expansions in language, expansion in platforms. So we're now building our chatbot on WhatsApp. Because mobile apps, again, have so much download frictions and stuff. So that's the role that I lead, is really thinking about how do you take it to Bharat, how do you take it to India, how do you really scale it to the next 100 million Bharat users in India. And it's exciting because the scale is unprecedented. We already have a lot of in English across the world. We have almost 5 to 6 million users around the world in 90 plus countries. So as a solution that's established and proven in the world, the excitement and the challenge of proving that model now in a context like India, which is very different, different users, different contexts, everything's truly very different. It's almost 0 to 1 again for us, for that Hindi aspect. So that's the bit that I lead, and that's sort of partnerships. And I'm very pleased to get to know more about all of you and your organizations. I hope to connect to just keep working together in the ecosystem. Thank you.
Great. So Sakshi, moving on to you. What is your organization's mission, and what work exactly do you do?
Well, I come from the Mind Root Foundation, which is basically based in Jaipur, Rajasthan. And we strive to educate communities about mental health, breaking down the stigmas and fostering understanding among the rural communities, which are deeply inside and remotely placed. So we work to bridge the treatment gap by supporting mental health infrastructure, training professionals, and providing affordable access to care. We are focusing on the youth empowerment as well, as by empowering children and youth with the skills and resilience needed to navigate the challenges in the modern world. We actively engage in the advocacy efforts to drive policy changes and secure funding for the mental health initiatives. Our most chosen and well-versed plan was about the Chopal, which basically means sort of a discussion place in the rural area. So we have set up Chopals in the most rural places of Rajasthan, where we work for the communities who are even not aware of what mental health means. And a lot of them are suffering from mental health from decades, and they are not aware of that thing, that they are mentally ill. So just removing the stigma and taking the cultural approach of Chopal helped us in normalizing conversations on mental health, encouraging people to even recognize the mental health related illnesses, seeking treatment and reducing stigmas. It also helped in creating a resource pool available to communities locally and the health system at large. This initiative was taken as a Udharan in G20 summit this time. It was presented on a G20 level to all the countries, that this has been taken one of the best initiatives, which has worked for the remotely placed rural area people who were even not aware of the mental health programs. And we have been recognized by the CM of Rajasthan, that is Mr. Ashok Singh Gehlot, and we run the mobile bus clinic as well. We go door to door to people, and we set up Chopals as well We go to door-to-door people for providing them medicines and the treatments and all. This mobile bus has been inaugurated by the Honorable Chief Minister of Rajasthan, and then we have worked. Our work was recognized 3 times by the Honorable Chief Minister of Rajasthan, Srimati Vasundhara Raje, as well, and 1 time by Galorji. We were recognized, say, 2 times by the CM of Rajasthan, and our NGO has won National NGO Excellence Award for Healthcare in 2019 by Mehes Foundation. So this is all about Mindroot Foundation, that we work for those people. Jaisa Desh Vaisa Bhes kind of is our motto. कि आप जहाँ पर जा रहे हैं, we have to connect with the rural population by being one of themselves. So our approach is simply Desi approach for the Desi people, so that they can connect us well, they can belong to us, and they can tell us what their problems are. So this is what Mindroot Foundation is doing so far. And my role in the Mindroot Foundation is a telepsychologist. I provide therapies online to them. Those who are not able to come and visit to the therapy sessions, I give them therapies online.
Wow, amazing. I think amazing intervention is, of course, amazing accomplishments along with them.
Thank you so much.
From you. So we move on to our next panelist, Ms. Samya Naseem, who is the co-founder of Loan Pack. So can you just tell us or share the objectives and the kind of work Loan Pack is doing in this domain?
Yeah, sure, Ruchika. And firstly, thank you so much for having me. It's great to hear from fellow change makers in this space. It's always more invigorating to learn more about all of the different kinds of activities that everyone is doing. So a little bit about Loan Pack. Loan Pack is a registered not-for-profit organization that I started along with a couple of friends when I was 21, fresh out of undergrad in engineering in India. And Loan Pack is really born from shared experiences and lived experiences. And I think it's from that perspective that we wanted to, one, raise awareness on mental health issues in India, and two, increase accessibility by bridging the gap between mental health professionals and the general public. Yes, mental health professionals are a scarcity in India, but even the step of people reaching out to professional healthcare, there is that big gap, largely because of the stigma as well, and largely because of other factors such as lack of information and resources. So Loan Pack initially focused on a lot of awareness initiatives on its early years. We did nationwide campaigns such as Loan Pack letters and collaborations with organizations like Uber and Google, etc. And then during COVID, we actually launched an entire chat-based platform that was free of cost with trained volunteers, which was called Loan Pack Buddy. And the objective of this was to really provide a replacement for people who felt hesitant to seek professional help, but still needed that safe space in order to be able to share their thoughts in a one-on-one setting. And that was something that we kind of bootstrapped and launched during COVID. And that was actually recognized by the UNDP as well as one of the more promising initiatives at that point of time. I think moving forward, we're hoping to continue doing our work. We are a team of young people and volunteers, and it's been very much led and driven by lived experiences of both myself and the rest of the team. A little bit about myself. I am one of the founding members. For me, it's been really important to listen to the people around me, listen to my peers around me, and learn from them, listen from other change makers in the space, and continue facilitating that ecosystem of growth and development in mental health in India. I'm currently based out of New York, but the rest of my founding team is still in India, and we work very closely together on how best we can continue making change in this space through Loan Pack.
Wow. Okay, great. So I think I have missed out Megha. Hi, Megha. So yeah, as the founder and CEO of Panacea HealMed, what exactly is the vision, and what do you foresee in this, especially coming from the healthcare side? What exactly is the mission and objective of your organization, and what kind of work have you been doing in this domain?
Okay, thanks a lot for inviting me, Kaushika, and lovely to be among such an inspiring panel today. I'm actually a co-founder and CEO of Panacea HealMed. And at Panacea HealMed, we firmly believe that right to mental right to effective and efficient mental health care access to mental health care is a right of every individual, and we strive to make it available for everyone, right? So as you all know, stress and anxiety have increased manifold in today's fast-paced world, and advent of COVID-19 brought mental health to the forefront, right? But there were still challenges that individuals faced in accessing mental health care and in a timely manner. So that is where we come in. So we wanted to address those challenges. And at Panisha Hillmed, we are an artificial intelligence powered platform. And we have automated the entire in-depth analysis and made it available for the person on their own mobile device. So it is a digital, touch-free, voice-enabled platform which the individual can take the assessment in the comfort of their own mobile device. And so I can just, because having access to the right mental health care resources is also important, as rightly put by other panelists also, because there is lack of awareness, lack of resources, and also since stigma and judgment is so prevalent in our Indian society. So all these factors have actually, they play a really important role in and affect people from getting help at the right time. So we want to make mental health care very available for everybody, so that people from different spectrums of life can come together and make use of all the facilities that are available to them.
Okay, thank you. Vidyaji, coming to you. So as the founder of Red Dots, which has been, with 19 plus years of experience guiding CSR leaders and NGOs, mentoring them. So what has Red Dots done in this particular space? And are you looking at any other interventions after listening to the other panelists? Yes, please share.
Definitely. Yes. So thank you very much, TheCSRUniverse, and happy to have met with this panel, because there are so many different things that you guys are doing, and I feel that it's a very good platform to know each other. As Right Dots, it's a CSR consulting firm, and what we exactly do is we work with corporates as well as NGOs. So in terms of corporates, helping them have a good, impactful CSR work is what we do. And in terms of NGOs, we have a lot of NGOs, 3.3 million NGOs in India, and we try and work with those NGOs to have they do wonderful job at a grassroots level, but then they're not getting that CSR funding every time that they want to make some projects. So we help them out in terms of how do you come up with proposals, how do you plan a good project, how do you design a good project, and how do you run that project impactfully. So that's what we do. And as a part of my role in designing projects for corporates, I work very closely with schools. So a lot of government schools is something that I work with, and very obviously I can see what damage COVID-19 has done to our children. That's something that we work really closely with, and every program that we design in this particular space, we ensure that it meets at least one of the wellness dimensions with school children. And when we want to take up projects with respect to environment, we look at setting up biodiversity parks, where it's not about just increasing the biodiversity, but bringing up a place where the elderly and the women can come and spend some time there, where they don't get to go out of their homes, they come and spend some time. So that is, I would say, one of very successful projects that we are doing across in Tamil Nadu, setting up biodiversity parks. And the next thing is, I also got an opportunity to work with observation homes. Most neglected crowd, that I would say, and their mental health is very important, because once they come out, they're already labeled, and it's very difficult for them to probably come back to the mainstream, or they simply don't want to come back to the mainstream because they've experienced something really bitter, and they don't want to do that. So we are identifying opportunities for them. And currently we are working on an inclusion park, which is going to be set up. And though we call it an inclusion park, we're looking at a very exclusive space for special children. And to my surprise, what we found is, as a part of the initial core team discussions, more than the children who are going through some kind of disability, it's the parents who needed, therapy, or I would say just in terms of counseling for these parents, because they are seeing these children in and out, and they have thousands of questions where they are not able to share with somebody. So we feel that this particular space, which is going to come up for these children, will also serve as a place where these parents can come and share, their problems with each other and come up with solutions, or at least feel that, I'm not alone in this.
Great. So my question is again open to all of you. So everybody's been talking about the impact of COVID-19. With the lockdown, many these problems started surfacing, And so from all of you, I want to know how do you think has the landscape of mental health in India evolved, and what are the challenges, current challenges, and the gaps, and what solutions do you see, to fill those gaps or address those issues? So I would again want to start begin with Ashwini ji. And yeah, yes, please.
Thank you, Ruchika. So, I feel that the mental health landscape in India is currently evolving. COVID has, definitely brought in, I think it has impacted everybody across the world.
Absolutely.
There was not a single human being, I think, who was not impacted by COVID. So COVID has, actually also there's a lot of learning. I personally feel that there has been a lot of
I think there is a slight lag.
sorry.
Yes, yes,
Can you
yes,
hear me?
yes, yes, we can.
I definitely think that there is growing awareness. Um, Also, there are, there's a growing awareness around the mental health issues in India. And this is also thanks to a lot of advocacy efforts and public stand. And the very fact that mental health and physical health cannot, is my voice clear?
There's a connectivity issue. Maybe you can switch off your video and speak.
Yeah,
That'll
maybe. Yeah. So what I was saying is that people are
your voice is not very clear.
one whole.
Would you like to
Okay.
connect again, please?
Yeah, I'll do.
Yeah, please.
Take,
Yeah, please do that.
connect.
Could you please reconnect? I think we have so Bhavna, I would want to know your view, since your organization is working especially for victims of domestic abuse, and I'm sure the number must have risen, increased in terms of the calling out for help. So what challenges do you see in that domain, and has there been any kind of redressal? Has there what kind of interventions you think will solve the issues at hand?
Sure, sure. So yes, my campaign is at the intersection of mental health support for survivors of domestic abuse, and also talking about the scenario of mental health awareness in India. I think the conversation has always been the need of the hour. With COVID, what happened was people started bringing it up with many instances that we've seen in our society, and everybody personally, trying to adjust to the dramatic shift and also trying to cope with many kinds of losses. The conversation has come forward. So that's definitely there. And also speaking about from my campaign perspective, so domestic violence rates have also almost spiked to twice in India. The National Council for Women and many emergency police units who attend calls for domestic violence helplines have reported a spike in domestic violence rates. And we all know the impact of domestic violence on women. It leads to anxiety, it leads to depressive tendencies, and many researchers also show that women who have been through severe domestic violence show tendencies of post-traumatic stress disorder. So also during this time, the government has launched a WhatsApp chat helpline for women who are being abused at home, so that they can drop a message to receive help. And also in October 2022, on the occasion of World Mental Health Day, our government has also launched a national mental health helpline number called Telemanas. So this has been launched across India in more than 20 languages, to make sure that for those who do not have ready access to help, those who could not afford help, they can reach out, they can seek support, and they can seek help. So this is the update, latest update as of now from my end.
All right, that's great work. So, Sakshi, moving on to you, since you are a psychologist and we are talking about the challenges and the solutions, how to address these gaps, I would want to know what kind of strategies can be implemented to combat this. First of all, this persisting stigma associated with mental health, and of course, as you said that in rural India, people are not even aware about this. Forget about sensitizing others. So, what is your take on that?
See, there are a lot of stigmas which are there around in the society, the cultural factors, the traditional cultural beliefs in which the people see the victims or the people who are not mentally stable or having mental issues. They call themselves as the shame. They are bringing shame to the families. And then there is a lack of awareness, that limited understanding of mental health issues, which are contributing to the stigmas. They are not ready to accept that it is mere a mental illness or a mental concern. A lot of children are suffering from this problem, like autism and ADHD are the major causes. The problem, the people are not ready to accept that the children are having certain mental problems. So, and they could be treated. They could be treated well with the therapies, because the word mental itself is a big chaos, or a big stigma in our Indian cultural society. The portrayal of mental problems is highlighted or exacerbated so badly. Then
Right.
there are religious and spiritual beliefs. In some cases, religious beliefs may be used to explain mental issues, that there is something, possession or divine punishment is there, because of which the people are acting or portraying like something issues like that. So these are the major causes of stigmas, along with like discrimination and isolation. People who are having mental conditions often face discrimination and social isolation as well, due to which they're facing problems in the marriage proposals, and even the jobs prospects are not there, due to which sometimes they comes up with extreme consequences of committing suicide or worsening their own situations. Gender and mental health issues are there. Gender norms can affect how mental issues are perceived.
Right.
For example, men may feel pressured to appear strong, and maybe less likely to seek help out of that, because they are, this is all times portrayed a man, or even a boy, he cannot be weak, he cannot cry, you're supposed to be a boy. They develop that male ego, that even if they're having extreme mental conditions, they cannot come out of that. They're
Right.
not able to come out of their problems. A lot of individuals again are not able to identify their genders, our LGBTQ community, and when they try or strengthen their courage to speak out in the family first. A person always comes in the first place to their friends and then the family. If they are not ready to accept it, the way they are, if they are coming opening up, then it becomes very difficult for them to open up in front of the whole society, thinking of even my parents and even my family is not accepting me, who else is going to accept me in that
Right.
case? So they face very tragic and unsupportive response from their families itself. Then the media and the entertainment, the portrayal of mental health in media, and in Indian media rather, in Indian media and entertainment, has sometimes perpetuated stereotypes and misconception, reinforcing the stigma. They show the negative extremes instead of showing the positive. They always show that there is, if there is a person is having some mental health issue, then either he's completely gone. They don't portray such cases that yes, there was mental issues, and after getting a proper intervention, overcome that. Instead, the portrayal should be that so that people can come up for that. No, there are very limited access to the services, the scarcity of mental health services in rural areas, especially, and the uneven distribution of resources exacerbate the stigma. Many people do not have the access to professional health care, making it even more difficult to address their issues discreetly. The family pressure, as I told you, families often discourage individuals from seeking help. ये तो होता ही रहता है, as you told about your postpartum depression also, and this is very normal. ये तो सबके साथ होता है. If a child is not speaking, on time, if he's showing symptoms of autism, or if he's showing symptoms of ADHD, then a lot of parents are coming up to me who are saying that their relatives or their neighbors are saying कि आप अपने बच्चे को ठीक से अच्छे manners क्यों नहीं सिखाते? He is not stable. वो रुकता नहीं है, कूदता रहता है. He's jumping all around. So they don't even let the parents to think about this thing, that there might be some issue going on with my child who is not able to understand. So acceptance of this, तो family pressure का इतना pressure होता है family का और आपके neighbors का, surroundings का, society का, they don't let the person to accept there is something wrong with me. And even when they accept it, fine. There are a lot of parents who come to me and say कि हाँ हमें पता है, we are taking the therapy, but we are not disclosing it to our families as a stigma again, because they'll label my child as ये तो पागल है. The extreme conditions you see.
Yeah.
Then addressing the stigma, इसको किस तरीके से we can address or how we can intervene is the public awareness campaign.
Okay.
Promoting awareness and education about mental health is crucial. This time, mental health is the most, leftover topic to talk upon in the schools, in the campaigns, in the colleges. This should be one of the most talked subject, I think so. Because now, even if the child is like 3 or 4, they start showing their symptoms, and by the time there are a lot of people who have come across me who are like above 60, and then they get to know that they were having problems. There was I'm just quoting an example over this as a personal experience or a story, that there was a lady in Rajasthan who came to me, and she was having OCD problem, and she was 60 plus, and since like from last 3 to more than 3 decades, she didn't even know that she was having that problem. उसको उनको बस ये लेबल किया हुआ था कि इनको तो साफ सफाई का बहुत ज्यादा शौक है.
Okay.
That lady was so much in problem out of that, and when she got the intervention, when she got the medicinal prescription and all, she got out of it, and she was so thankful कि मुझे तो लगता था कि I'm born like this. Maybe I have some certain high, hygienic things. Then there is community support, encouraging community-based support systems where individual can seek help and share experiences that can combat isolation. We need more heart-to-heart talks instead of just political talks. We need more heart-to-heart talks, that what you're going through, what is happening with you, everything is going to be all right. Things happen. You should go and intervene, or you should go and get yourself checked and diagnosed. These should be the need of the talk of the hour. Then policy changes, implementing policies that prioritize mental health, increase access to mental health services, and protect the right of individuals with mental health conditions are need of the hour. Media responsibility, as I said before, encouraging responsible portrayal of mental health issues in media and entertainment to counteract stereotypes and to spread awareness among people of all age and sex. Cultural sensitivity, tailoring mental health interventions to be culturally sensitive and respectful of local beliefs and traditions. So there are a lot of efforts which are going on, and a lot of efforts which we as a Mind Root Foundation, we are also doing. We are our approach, as I said before, is holistic approach. We are taking care of all the counterparts of everything. We are doing school and youth programs also. We are running marathons. We are setting up boot camps, and we are going to the rural population. There are 2 villages. One is Dudhsar, and another is Govindgarh. And now we are expanding our work to Churu, Rajasthan as well. So our another program in which we are incorporating everything and calling it a holistic approach, because pehle it was just a mental health camp. Now we are incorporating their families and their surroundings as well by incorporating our Kheti Badi program. In that, we are bringing up or motivating them to come along with their families, and wahan ka jo bhi local crop hai, we are trying to make local dishes. We are promoting handicrafts also. So we are picking up our volunteers from that community itself, from the Rajasthan, just gaon ke andar we are going. We are picking up our volunteers and picking up our managers from the community itself, so that they can connect well. Unko ye nahi lage ki bahar se kaun aa gaye and we are not able to connect. There are a lot of people who cannot come and get consult or get counseling in the group. So they come to the bus, the mobile bus clinic which you are talking about. They come to the bus and talk about the problems which they are facing on.
That's great. So actually, I'd like to move to our other panelists also, because we have pressed for time. So Deeksha, since Royal Rajasthan Foundation has a very beneficiary-centric strategic approach, so what exactly are the challenges that you see while you implement your work, and what do you think are the solutions to address those challenges?
Sure, that's a great question. So it all started with our theory of change. You know, we were thinking that we have a pyramid of empowerment, and we
Right.
are like, okay, women have to go from this level to this level to the next level. But in a state like Rajasthan, what we noticed is when we were meeting the women, like I came across a woman, her name was Achuki, and I asked her, "There's a very interesting name. का ना मतलब क्या है?" So she got embarrassed, and then my grassroots partner explains is like, oh, she was the fourth daughter, so they named Chauthi beti Achuki, like.
Oh,
So
okay.
it's not just that. That was just one of the examples. And then I realized I started questioning all their names. Their names were Hechuki, Galti, Mafi. One kid
Oh,
was named Missed Call recently, girl child, right?
yes.
So when when we think of uh, women empowerment in a place where the burden of like just being a female is a burden, your name is reminding you every time someone calls out to you. That kind of, even before we get into other larger issues of, disease in other forms, this is the kind of conditioning, intergenerational conditioning, that
Hmm.
we were like, okay, now how do we fight this? Because how do I take a woman from, I can give her the livelihood option, farming kara diya, khet kara diya, sapling de diya. But the women were like, I can't get out of the house. I can't do this. I can't. This whole, I can't. They had zero belief in themselves. So that was the society was the biggest issue that we thought that we have to fight against. And that's where the mental health intervention also came in, because it was about the behavior change, not for any one small thing, but just so that they start believing in themselves. That was the biggest, that's where we are coming from, and that's what we are trying to change over here. We recently did the mental health workshops, and I met with the women, and
Mhm.
it was eye opening, because the older generation of women, they were just dismissive. So we told our partner, "Okay, you bring everybody, all age groups, literacy agnostic, सबको लेकर आओ. Let's understand how women are reacting." Because it's very easy to say, I did a workshop, mental health awareness workshop. What did the women get out of it? It's not just a tick mark exercise, right? Because we are making it something larger. Uh,
Right.
the older generation was like, yeah, I've had this my whole life. This is normal.
Yeah.
I cry every other day. This is normal. Like they were like, this is not a mental health issue. I go to one Baba for this. So they are
Oh,
okay. But then the younger generation, they surprised
okay.
me. They came up and they spoke to us and they said, okay, you know what, thank you. I now know I have anxiety. I didn't know, I didn't have a name for it. I just thought this was something I'm going through. And somebody came in and says, I now know my mother has depression. Thank you. We gave them the mental health helpline number. So we knew it was a hit and miss. 30% of the women actually felt that it worked. 70% ke saath, again, we have to go back to the drawing board. And I think that's what's important when we work with communities. Like I can do a national level campaign with the broadcaster, but when we really get down to it, like
Mm-hmm.
it has to be very personalized. Mental health, you can bring basic awareness, but even someone like me, when I know I'm dealing with my anxiety, it takes me a month to reach out to my therapist. Things stop me as well. So now we are talking about women who've never heard of this, and I'm an advocate and I take long to take that step. So I think that's the main thing, that one is, how do you communicate that awareness, how do
Mm-hmm.
you provide that access, and the safe space. Even if you want to reach out, who do you reach out to? So like it was being mentioned that the women can come in together, the caregivers
Mm-hmm.
coming at the inclusion park, right? They
Mm-hmm.
come to that safe space. So women traditionally used to go to watering hole somewhere to collect water. Wahan pe bawris say step wells, that was their safe space. They used to go there and congregate and talk.
Okay.
If you see in the urban setting, kitty party is a safe space for women. Like I see my mother's her mood changes entirely after her kitty party. They
Uh-huh.
get to step out that once a month, dress up, go out. So
Mm.
awareness, personalized communication, and then the safe spaces. What is that safe space for the community we are serving? Um, I think, and we have to also accept that it may not always work. So
So
be
I
there to go
that
back to the drawing board.
is a good start, that you're customizing, you're tailoring the strategies according to the need of the beneficiary. That's a great thing to do. So now coming to Ria and Megha, since both of you have a tech background and technological solutions to problems of mental health. So I would like to ask Ria first, that you have already heard the challenges, but at your end, what kind of challenges did you face? And what do you think are the solutions to address those challenges? And then we'll move on to Megha to answer that.
Sure.
Especially if you take innovative technology into the listening realm.
Absolutely. I think the challenges and the issues, have been very beautifully articulated by everybody else. I'll actually pick up on the examples most of you have shared around just the context in which most of these people live. Whether, it's the example of the reality of women, or everything that Sakshi spoke about in terms of family, etc. There's two things we've learned very quickly, not only, in the last 5 years of building Visa, but also especially in the last 1 year of doing this for Hindi in India. There's two things. One is that everyone talks a lot about stigma and judgment and all of those things. And it's very real. But I think if there is a way in which, and that was the starting point of our problem statement, which is, how do you really overcome stigma? You can't change society overnight. You can't really change cultural norms overnight. So what can you do to reduce it the most you can? And one of the things I've seen work is that, and I'll use Visa as an example, but I think there are a lot of other solutions as well who are now starting to do this, is if you reduce every single barrier of identity, it's a really powerful tool to get people to open up. And what I mean by that is, for example, on the Visa app, for instance, it's a very intentional design feature where we don't ask someone to log in. You don't have to put your email ID. You don't even have to give your real name. Anybody can put a fake nickname for free to start talking to the chatbot. And that chatbot has been built on AI models that are empathetic, that can sense what you're saying. It's fully clinically backed and stuff. But the idea is that it's so anonymous and it's so private that it almost feels counterintuitive. We were very surprised initially, when we started doing research to prove does this work versus not. The amount of time it took users to open up to a robot, basically an AI chatbot, is much faster than it took them to open up to a human therapist, which feels counterintuitive because it's so awkward talking to a robot, right? But because even with a human therapist, for most of us, as progressive as we may be, if any of us go to therapy and we speak to a therapist, it's still a real human being in front. It takes time to build a bond. There is some judgment. Identity is very real. Biases aa jate hain, all of those things happen. And so I think a digital intervention, this is why it has a lot of power, because if an AI can give you the space to just vent, and sometimes that's all you need, is just somebody to ask you, how are you feeling? That itself, I think, in the context of most of our Indian users, we learned is something most of these women especially have never heard in their lives. In the early days, we started doing some user testing to actually see feedback kaisa hai, and we did it across intersectional users, different caste identities, different class identities, to really see sabka response and feedback kaisa hai. And a very significant share of particularly underprivileged women said that mujhe jeevan mein kisi ne, nobody has asked me how I'm doing, how is my day. And I think just that question, that if an AI chatbot has a notification on your app can ask you, it has done wonders, and then we have case studies to show that it's really powerful. So I think that's one way we see how technology can supplement human support. I think we've never wanted to replace human therapy. We've never wanted to say that, digital is the solution. I don't think it is. But I do think in a lot of very real ways, when you think of scale, when you think of privacy, when you think of barrier of human judgment, I think digital can do some things better than human intervention can. I think that's one, and then I'll keep it brief, but I think the second quick point I wanted to share around just solutions was also that we need to reach users where they already are. And I mean, I know this phrase is often used a lot, but particularly for mental health, it's what I alluded to earlier, is that a lot of the need is unexpressed right now. And it's not people's fault. Like, we're not saying that, you're not aware or you're stupid or like, why aren't you asking for help? It's just not part of their vocabulary or exposure or just even priority. And so I think for people who don't have an expressed mental health need, how do you reach them? They're not going to come to a mental health professional. They won't visit their primary health center. They will not go to a peer or a kitty party or a stepwell to speak to another person because unko pata hi nahi ki unko help chahiye.
Exactly.
So that's the second problem to crack. And can digital help there, which is if they already have a phone, if they already have WhatsApp, let's say, as a platform, can we reach them in their phone with some way to start a conversation that unlocks some emotions, some form of, breakthrough in reframing that can start to unlock that. So I think that's the other thing that excites me personally about digital is, we need to keep doing everything else, but at the core of it, for the people who don't even have the felt need, how do you help them? And I think digital can do wonders there.
Wow. So Megha, do you agree with her? What do you have to say? You're on mute, Megha.
Yeah, so I agree with what Ria has said. At Panisha Hillmet, we do believe in the same virtues. That we also want to make the assessment available for the masses. Right? And the biggest hindrance is the stigma and the judgment that is prevalent in the society. People don't want to take and come out and take help. Right? First of all, people are not aware that they need help. Some people, they start living in denial. It's very hard for people to accept that they actually need help. Even if they are, even if they're coming from very well-to-do backgrounds, or they might be coming from very economically weaker backgrounds, irrespective of the backgrounds, people have that fear of judgment and stigma that lingers around in their brain, and which prevents them from seeking help at the right time. That is where technology actually comes in, where in our platform too, we have clubbed AI and made use of that platform, which is AI powered, and made the assessment in a digital, voice enabled and touch-free manner, with the way you can actually talk to the platform, and thereby the assessment, the in-depth evaluation takes place simultaneously. So it is very easy for the person to open up. So there's no person sitting across from you. Right. So when you're opening up easily and you're talking about your own problems, it is very easy for them to open up about the problems. And then it enables us to identify those issues which are affecting the individual and then provide the solution in the timely manner. That is also one of the biggest factors that I would like to say, that to get help at the in a very timely manner is also very of big importance, because if you go on living with a problem in an untreated or undertreated condition, then it can go into a negative spiral. Right. Recently, also, you might have seen a lot of suicide cases are coming up in education institutions like Kota. Today, also, there was a headline saying one student who was a NEET aspirant, she committed suicide. So a lot of these cases are prevalent. So we are also collaborating with educational institutions and social organizations to create awareness about mental health, and also to make make assessment available for the masses, so that it is easier for the institution also to identify those people who actually need help. Right. For a psychologist, like if let's say we talk about an educational institution or a school, for example, there are 50 students, average 45 to 50 students per class. Right. And there are how many psychologists do we have? 1 or 2 psychologists in the entire school. Right. And the number of students that they have to cater to, that is a very large number. So it becomes very difficult for them to help. Even though they might want to help, they can't help everybody. Right. That is where our assessment also comes into play, where the student can take the assessment in the comfort of their own mobile device, and the results are kept anonymous. The student identity is kept anonymous. Even we don't have the results with ourselves. Right. So the results are only open to the designated professional who has access to it. The class teachers don't get access, because sometimes the stigma also comes in from the class teachers side, right? Their friends, their classmates, their teachers also sometimes they add to the woes of the students. That is a very important thing to concern for us. That's why we conducted one of the assessments in one of the schools, and then we realized students, when they spoke with us, they said, "Ma'am, अगर हम ऐसे बताएंगे तो कोई हमें हमारे marks तो नहीं काट देगा." So they were because we collaborate with social organizations and also educational institutions in economically weaker sections in Delhi NCR. and Sai Seva Sadan also, we collaborated with them, and we did assessments for them as well. So we realized that students are so fearful that they don't want to come out and seek help, because they think if somebody comes to know that they need help, so it will go against them, right? It will be a prejudice against them. So they didn't want to talk up. But with our assessment, they were quite happy that they said that since it's anonymized, each student was given their own unique IDs, and the results were only sent to the designated professional, not to the class teachers, not to anybody else. And also, I would like to add, the Government of India has, in the Ministry of Education, in accordance with Government of India, they launched the Baro Darpan guidelines last year, wherein each school has been advised to have a mental health panel. So, which will be chaired by the principal, along with some teachers from the school and the psychologists as well. So we want to facilitate the process for them and use digital technology in order to complement their efforts. We don't want to bypass the doctor or the professional or psychiatrist or psychologist in any other way. The technology has to be there to complement the already existing resources, so that they can come up and help the individuals in the best possible manner.
That's wonderful. That's a wonderful, thought process altogether. So coming to Samya, your organization has also been focusing on, providing mental health services to especially the youth. So what challenges did you encounter while implementing your programs and initiatives?
Yeah, I think our organization is extremely focused on the youth. And like I said, it's born from lived experiences of myself, my team, my peers, the people who I've observed around me. So a lot of that was actually having the willingness to step up and share that I am going through something, and that's okay. So sometimes you do have to lead by example. You do have to put yourself out there and say, this is my story, and have the willingness to do that. And I think once you do that, you set that example, you're also encouraging someone else to have the courage to accept, maybe not on a public platform, but at least to you or within their, a safe space, that it's okay for them to do that. And it doesn't mean that there's something wrong with them. But apart from that, some of the challenges that we faced was also just, I think overall research has proven that mental health disorders and illnesses typically manifest amongst teenagers. The first signs are amongst teenagers. And teenage is a really difficult time, we're having all the academic pressure, especially in India. And we're trying to be cool, we're trying to be popular, we're trying to fit in, we're trying to rebel against our parents. And at that point, the amount of pressure, the amount of social pressure that we have and that we face is incredibly high. And at that point of time, when we go forward and we say that, oh, we need help, sometimes there's not as much support that we need even from the adults in our lives, the ones who we're supposed to trust. Because sometimes even our own parents say, kahan galat gaye? Where did we go wrong? How did we ruin your life? There's that sort of a questioning that comes back to us, even when we find that courage to seek help. Right. But however, the way that we've dealt with it is that we've kind of worked around creating safe spaces that are led by the youth, that amplify the voices of the youth. We have worked with influencers and celebrities as well to set that example, but we're very driven by amplifying the voice of the youth and of that lived experience as well. And it's great to hear the amount of digital interventions that are happening, because I remember when we first pitched the idea of Lone Pack Buddy as a chat-enabled platform of support to other organizations, and the general response that we got was that this can never happen. Mental health can never be digital. But I think COVID really helped evolve how the general public and the existing systems and infrastructure view digital health interventions, as well as the development of AI and amazing technologies like where Ria and Mega are working. And I think now there's a greater willingness to trust in such systems and actually leverage those systems. As a computer science student by background, I completely believe that technology can be such a fantastic enabler and such a great agent of scale for existing interventions that happen. Of course, it can't be the only solution, but I think it goes fantastically in line and hand in hand with some of the policy work that the government is doing, some of the hands-on work and rural work, groundwork that Sakshi ji is doing, as well as the existing tech interventions that the other organizations are doing as well. So definitely from that perspective, the youth, I think, at least I think there's positive change, still a lot of work to do, but there has definitely been good progress over the last few years.
Lovely to hear that. And before I move to Vidyajit and ask her the question, we have a question from the audience. Could you please unmute yourself and please ask the question? Team,
Yes, I have a question. I have seen there lots of good initiative in the mental health area, and which is the least talked about. I want to understand what are the measures that have been taken to reach out the larger audience, because it's a very close thing that we are knowing. And what are the initiatives, what are the measures, what are the steps, what are the media promotions that we are taking to take it to a larger audience?
whom have you directed this question to?
I have directed this question to just I forget the name.
Sure.
I have directed this question to Reha and Meghna, both, because both are also on an AI-based product on the mental health, and which is really appreciable and it's a nice initiative.
Okay. Ria and Megha, could you please quickly share your views on that? Ria, we can start with you.
Sure. Thank you for the question, Govind. I think from what I understood, if you're asking, what's the way to scale or like really take it to the masses and people and make it mainstream, I guess.
Exactly.
Yeah. I think it's a tricky space, mental health, right? Like I think unlike certain topics where the value is very non-controversial, for instance, in agriculture, this is a seed. It will lead to more yield. We recommend this and everyone should use it to all farmers. It's a very non-controversial, largely way of portraying value. Mental health is trickier. It's so personal, it's so subjective, which is why I also think like one of the reasons why there hasn't been one unified national message campaign is because there isn't one message that every human being will resonate to. It's so heterogeneous, it's so subjective, it's so personal, which is why it's complicated and tricky and not as simplified. But having said that, I think the plus side of this is that unlike agriculture or a seed, everybody feels mental health. And so it is universal in that sense, that everybody actually has the need to talk about it. So that's my thought on just, I think, why scale is tricky. I think it's particularly in the Visa context, what we're trying to do is to reach like users in India and Hindi. We're starting with just creating something that finds fit with the users. So, doing it in Hindi to start with, doing it on WhatsApp, both on languages and platform, reducing access barriers, doing it free of cost. That's the starting point to make sure more and more people are able to access it. And then finding the right distribution. I don't think the right way for us or even any digital mental health intervention is to, just put up an app on the app store and expect people to download it. It's not just going to work, which is why you need to partner with people who have trust and distribution. And so, folks like organizations on this call who actually work with communities, that's essentially the focus of my work in Visa is, find those partners, find the right people who have built the trust, start there, start building evidence. And there's nothing better than word of mouth when it comes to mental health. So that's at least the path or the hope we're planning to take. I see Bhavna's hand is up, but Megha.
Yes.
You want to say something, Bhavna?
Right after you.
All right. Okay. So thanks for the question, Govind. So yeah, as likely put by Ria, scaling up is an issue as far as mental health is concerned. But then definitely there are things that we can do to improve the situation at hand. So one of the things that we can do is by creating awareness, again, by collaborating and partnering with organizations, social organizations and NGOs who are working for the same cause, and then going to the masses and then creating awareness about mental health, right? And then it is important to get the right help at the right time. That is also, we need to teach the masses and we need to make them aware that mental health is just like another disease. Like we don't feel any fear in approaching the doctor for any other illness that we might have, right? Any other physical ailment, if I might say. So even for mental health issues, there's no need to feel disparaged or refrain in any way, or have fear in any way. So it is important to create awareness amongst the masses about the importance of getting the right help at the right time. Another thing that that can be done is by incorporating various Indian vernacular languages into the platform and digital aids that are available, so that it becomes available to the masses, especially because most of the apps today are usually English-based apps. They're all in English, right? So the only top percent of the people get access to that. But if you want to reach the masses and the common people, you need to incorporate Indian vernacular languages. Only then will you be able to scale up and then reach everybody and that will, I think, will resonate with the mission of the organization that you're working for too. And that's what we are striving to do at Panisha HealMed as well. The app is currently in English language, but we are working on creating the app in other Indian vernacular languages as well and make it available to the masses.
Yes, Bhavna, you have to add something to that.
Sure. So it's a very important question of how to take the awareness to the masses, how to maintain psychoeducation. As somebody who's also a psychologist or somebody who's working in the space of mental health awareness and psychoeducation for a long time, I know people surrounding me know that, okay, Bhavna talks about mental health, there is this session that's going on. But what I believe will make the most powerful impact is when people who are not from the background openly speak about mental health. Just have it like a conversation within your communities, within your family and friends, and talk about how you're feeling, talk about seeking help, how it's more brave. That I think will make the most impact. I see a lot of mental health NGOs, like there's also mental health NGO that I run. So there are people who are advocates, there are people who are psychologists, therapists. They actively promote seeking help. They actively promote professional services like counseling and therapy. But I think it will really have a lot of impact on the reaching to the masses when people who do not have the background speak about their experiences, speak about how it has really helped them and made a difference in their life. And I think it's shared responsibility within all of us to make sure that we normalize these conversations. Because just like how we go see a doctor when we have a fever or a viral, it should be just as equally important to seek help when you're not feeling okay, when you see this for a prolonged period of time. And I think at Ungu Collective, which operates in 4 different countries, out of all the online petitions and campaigns that run, there are more than 10% of all of this that are raised about creating more awareness about mental health, or it could be accessibility of services. So I think when commoners and everybody else who take it as a shared responsibility and speak about its importance, that's when it really reaches the masses. And especially in our country where there's a lot of stigma, we should all really come together to break it.
Absolutely bang on. So Vidya ji, I'm coming back to Diksha just after Vidya. I'll come back to you with the as a mentor to the social sector stakeholders, what solutions do you propose at so that their implementation, their execution, it becomes more impactful?
Okay, so thank you for the real life case studies that are shared by you, because I'm really happy that women are so stronger. At least by stats, it looks like the suicide death rate in men is 34%, whereas for women is 13%. So we women are much stronger, and I'm really proud of it. Well, Ruchika, I would just like to touch upon 2 areas which I think most of us didn't talk about. One is the school and the kids. How we handle it, because my focus is completely on that. The reason being, India has seen 13,000 suicide in students, which is 35 students per day. Imagine one classroom getting washed away every day. So that is the number that we're seeing, and it really gives me sleepless nights when I see the statistics. And what is that? The main reason is, one, fear of examination, failure. The next is the aspirations that they have, which they themselves are not able to uplift and be up to their expectation. And the next thing is about the kind of increased screen time that we have. And the 4th one that I read was parental fatigue. When did parenting become one more task in our country? Something really worrying, because parental fatigue is one of the main reasons where they are not able to focus on the children. They themselves are not able to get through the phase that they are in, and it's also impacting the children, which they carry it on to the school. And here we are talking about 34,000 schools in Tamil Nadu alone, where there is the biggest digital divide, because they don't have access to internet, they don't have access to the technology that we are talking about largely. So here there is a demand where they really need somebody to talk to. So what happened to that access to grandparents? Which is not there. It's all nuclear families, and the access to grandparents is not there, which is one reason. Forget having one psychologist in a school, which is it's very difficult these days considering the mass that we have, whereas every family has a grandparent where a parent can talk to, the child can talk to. And the other side of it, the dementia cases are really on the rise. So the Goodfellows initiative by Tata, where they're funding, that is a wonderful initiative where now it's become I would say a model, a profit model itself, where they're identifying individuals, youth who have a very good emotional stability, and they are termed as grand pals. And they go just talk to elderly people, and they spend time with them. They probably read newspaper for them. So which means there is a demand and there is a supply also. So there is so much of wisdom on this side where the elderly carry, and there is so much of need here with this current children that we have. So these two, something which if we can bridge it together, with the help of your own technology, have students interact with old age homes, bring in a system where they can call and talk to them and spend time with them. And probably the biggest of problems that we face, you just take it up to an elderly person, they might be able to give you a very simple solution. So my way of looking at it is very accessible ones, very simple ones that we can come up to, where parents will also have a breather saying, okay, I have somebody who will talk to my child now, where half of the problems will be solved. Yes, Ruchika.
Ruchika, your screen is frozen. I think Ruchika has lost connectivity. I'll come to Deeksha. I think you had something to add.
Yeah.
Sorry, I'll just pin myself.
Yeah, I'll just keep it brief. The conversation on awareness, I'm just going to put a link in the chat. This was something that we have attempted. What we realized is that the more influencers and the more like we're talking about normalizing, right? So if we talk to influencers about it and they open up about their mental health, and that's something that we see the power that we have, right? So when we're talking about awareness at scale, when a Deepika Padukone comes out and talks about that she had a mental health issue and there's depression and she's running a non-profit around it, I think that makes a difference. And we should, when we're talking at the community level, because at the community level, if I give the example of a Deepika Padukone or a Shane Warne, they don't care, they don't understand that those are not role models for them. So what we're trying to work on is looking at local influencers over there, very much like any other marketing campaign that we do. I think even this needs a very concerted effort to understand that who are these people going to look up to. Finally, like I can talk about mental health in my house, but if nobody cares that that what I say is making sense to them, it means nothing. So just identifying those influencers at whatever level, whether it's mass media, whether it is starting a social media platform, like there are multiple now. There's MH Advocates, even something like an Agents of Ishq, which talks about the sexual health, which is such a repressed conversation point in our country and just the world, right? Even that they're normalizing fetishes over there. They're talking about it. Okay, this is normal, it's okay. So I think those kind of conversation points need to come out, and with people who in a place of influence. So that was the point I was trying to make.
Okay. I think Ashwini was left out. She had to add, yes. And
Yeah,
then
I think there is just, are you able to hear me?
Yes.
Yeah, I think one point that I wanted to make again, around scalability, we in India, I think we have 8% of sector or sector which is organized, like the working sector, which is organized. 92% is unorganized. But the CSR funding that we get, if there is some provision that is made through CSR funding for the mental well-being, which currently, we don't see, whether it is elders, whether it is youth. And I think elders, though we say India is a young country, the number of elders in our country is growing, and the abuse that elders face is again, nobody's speaking about it too much. So I really believe that if there is some kind of provision which is made through, CSR funding from the organized sector for the unorganized sector, I think it is going to, have a huge impact.
Yes.
Yeah.
I think Ruchika lost a connection again. That's okay. Ruchika, no, we can't hear you, Ruchika. You can turn your video off. I have turned it on. There is some connectivity issue. I would request you to please have this panel discussion.
Sure, no problem.
Share the closing remarks, please.
Sure. It's okay. Actually, where Ruchika is, it's raining since afternoon, so she has connectivity issues, but that's okay. I think we had a wonderful discussion, and I was listening to it all the time, even though my camera was off, but I couldn't, sort of take my attention away even for a minute, because mental health is something that I think we all have experienced the issues at some point or the other. Ruchika talked about postpartum, and I think 90% of the women would be experiencing some aspect of it. It just has to come, and nobody talks about it. So thank you for coming here and talking about it. And we hope to interact with you more in the future. Thank you. Thank you so much.
I'd just like to add, if I'm audible to all of you, that
yes, now you're audible.
We would love to connect with you all individually and speak about this comprehensively. So please allow us this opportunity, to reach out to you and speak about these issues more comprehensively.
Absolutely.
Thank you so much for your time and giving us this opportunity to speak. Thank you.
Thank you, everyone.
Thank you, everyone. Thank you for having us here.
Bye.